Dr. Perkins, can you tell us the role that the Center of Global Health played during this pandemic?
So in late February, the faculty in the center uh, began to organize for the current COVID-19 crisis that we're undergoing. And we started projects on reprocessing of PPE, including N95 respirators, to keep frontline health personnel safe. In addition, we're doing drug discovery studies. Dr. Stephen Bradfute, along with some others in this center, works in the BSL-3 facility and looks at different compounds that could actually kill the virus, stop the viral replication. And in addition, Dr. Hurwitz, who's here with me, she and Dr. Ching have been doing diagnostic testing for SARS. It's primarily involved molecular methods. So they're using the CDC assay and some others, including one from Wuhan, one of the original assays that was used. We have a study that's ongoing in the hospital to look at whether or not different fomites actually have SARS-CoV-2 in the environment, right? And so, for example, swabbing the PPE of healthcare personnel, doing skin swabs of healthcare personnel, and then in addition to that, looking at different things in the environment, such as doorknobs, computers, cell phones, etc. So we bring those samples back to the laboratory, and then we determine whether or not there's any active virus in those fomites that could potentially transmit disease. And then another thing that we just started, which is very exciting, is we are looking at immune response profiles in individuals with COVID-19. So we are following a cohort of hospitalized patients, and then we will use next generation sequencing to look at different immune profiles and different severities of disease, so non-severe disease and severe disease. And the reason one would do that is because when you can identify gene networks and signals within those networks, you then go in and target those networks with FDA-approved compounds for other drugs. And so that's something that we recently began with a team at the University of New Mexico Hospital.
Being that COVID is on a global level, how do you decide what to focus on and how do you communicate that with your team?
No, it's a great question. We have a large number of personnel in Kenya, in Western Kenya, and we communicate with them currently multiple times per week through video conferences. And so they are a little earlier in the epidemic right now, but they're starting to see some cases. And so, for example, we have ongoing studies there in pediatrics looking at malaria and different co-infections that the children have. And so we've canceled all of our inpatient hospitalization unless it's absolutely requisite for the most severe cases. We're trying to manage kids at home the best we can with our field team. And so we are adapting in that environment as well. It's a very different time there. Normally, the children come to the hospital. It's a slightly different setup. There is an outpatient unit there, but a lot of the children actually report to the ward because they're quite unstable. And so we've tried our best to keep individuals out of the hospital right now so we can be prepared for when COVID-19 actually becomes more active in that particular environment. One of the challenges in sub-Saharan Africa in general, and particularly East Africa, including Kenya, is that they are very short on reagents to do the testing, which means that there are clearly a lot of individuals there that are infected. However, they're not getting tested. And so they do have very strict quarantine procedures in place right now. So that's actually making a difference and mitigating some of the risk. But the real problem is there are a lot of cases there, and there's not a lot of tests to confirm those cases.
And have you found that to be a challenge here as well?
Yes, it's certainly a challenge here. It sometimes takes a protracted period of time for people to get their results back, although it appears to be getting better. And I think the state is doing an outstanding job with that.
So do you work closely with the local labs, such as LANL, as a collaborative effort?
Yes, there certainly is. I actually have an appointment at LANL as well as UNM. And so we work very closely with the folks at Los Alamos National Laboratory. We communicate with them multiple times a week. So, for example, we will procure samples, sometimes share those samples with different individuals, doing, for example, genomic sequencing, share clinical information, etc. Yeah, so there's certainly bilateral exchange and then focus regions that particular individuals and teams are working on. Daryl Doman, who's a faculty member in the group, he's looking at different mutations within the virus, and so he was able to get samples from the New Mexico Department of Health. And Daryl has been working on sequencing of the virus to make genetic epidemiological models.
So could that type of research help in vaccine development?
Yeah, it's important to understand the sequence information to obviously propel vaccine development. Yeah, it's an important aspect of it. It's also a means to tell where the virus came from, how much the virus has changed across time, whether or not there's local spreading, how active that local spreading is. And so, in addition to vaccine development, there's a lot of different things that you can do when you have viral sequence information. The other thing that we're working on is oftentimes different mutations in the virus can cause more severe or less severe clinical outcomes. And so, with the cohort of patients that we're following in the hospital at UNMH, we will also look at viral sequence information within those individuals to see whether or not there's any relationship between the virus and viral diversity within their system and clinical outcomes.
So it's one thing to be on the search for a vaccine. Meanwhile, there's already others that are working with antiviral drugs. Are you and your team working on that currently?
Yeah, the center is actively involved. That's what I was mentioning earlier. Stephen Bradpugh, who's one of the faculty members in the center, he has the virus growing in a BSL-3 facility, which is what's requisite for that particular virus. And so he and his team every day are screening different compounds. And so we work closely with the Center for Molecular Discovery, as well as the Division of Translational Informatics. And so those individuals are spending time looking at different compounds that could potentially be used to treat COVID-19. And then Stephen and his group see whether or not those compounds decrease the virus within the cell. There are a lot of people working really diligently on that effort, and I think it's absolutely a great effort. So probably the most short-term promise will come for FDA-approved compounds that are used for other diseases, and that's what we prioritize when we do the screening. That's one of the projects that we're working on, is to discover which genes within those pathways are critical in terms of their relationship with disease outcomes. And then you search for FDA-approved compounds to go in and change the directionality in many cases of those genes. So if it's turning on a gene pathway and turning on that gene pathway is associated with more severe clinical outcomes, once you find that top emergent pathway, you try to find FDA-approved drugs that will hit genes within that pathway so that you can change the outcomes of the pathway. So you first do that in cultured cells in ex vivo fashion. So you take peripheral blood and then you stimulate that blood with different compounds to see what your gene signal outputs become and whether or not you can get those to mimic patterns that you see in non-severe forms of the disease.
Can you talk about drug treatment, specifically remdesivir?
It's a very promising new compound, of course, for hospitalized patients. Of course, it's given IV, so that's a challenge for other non-hospitalized populations. Yeah, I'm optimistic. In fact, I had a conversation with the Department of Health today, and they are working diligently to make remdesivir available within this environment. So I applaud their efforts on that. Yeah, it's an experimental drug right now, and people are working diligently to try to get that in this particular environment.
How would you sum up the Center for Global Health's effort when it comes to research of COVID-19?
I think there are a number of people, many faculty working diligently in the Health Science Center, not only in the Center for Global Health, but across the entire Health Science Center. And it's been a good time because people have come together to address the challenges and everyone wants to make a contribution. So individuals and teams are working very hard to do the best they can. So I'm very proud of their efforts. I'm proud of the efforts of the faculty in the center as well.
For someone who might not know, how big is the Center for Global Health?
The center has international activities, so we did a calculation a while back with people on the payroll, probably 72 to 75 people.
And can you tell us about the history of the center?
Yeah, so I came here, UNM did not have a center for global health. So I came here from the University of Pittsburgh 14 years ago to start a center. And there's been a lot of support for the center. And I think it's great that we have a Center for Global Health here at UNM. We represent a very important and distinct geographic location. And so having a center here helps build local capacity within the state, and then of course globally with the many partners that we have.
And what about the students, both locally and internationally?
Yeah, we have an outstanding group of students, both students at UNM here in the US, and then we have a large number of students from different countries, primarily Kenya and Ghana, that come here, work in the laboratories, get training, and then take that knowledge back to the individual places where they come from.
Now, going back to the reprocessing of PPE, what made you want to do it?
That we were working with UNMH to do the reprocessing of the PPE. That's one of the original things we started. In fact, a manuscript related to that is going to have a press release tomorrow. And we're quite proud of that because that's detailed information on the entire PPE reprocessing. So from the safe collection, storage, the reprocessing, and then the distribution. So.
And reprocessing means cleaning, right?
Yeah, it does. In this context, there are different methods out there to do that. What we did, and the reason that we did it is because we were primarily interested in decontaminating N95 respirators. And the thing that appears to maintain the integrity of the masks after the reprocessing better than everything else and not affect the mechanical or electrostatic properties of the mask so they function as they should after this decontamination process is something known as hydrogen peroxide vapor. And so we actually set up 2 hydrogen peroxide vapor generators in some vacant, unused, shall I say, operating rooms at UNMH. And so we are doing reprocessing of N95 respirators there, as well as some face shields and goggles. The global supply of PPE is limited. It's limited in many, many environments. Unfortunately, we're not unique in this region, but it's imperative. If there's a message, since we're now talking about PPE, if there's a message that should get out about PPE, and I would be grateful if you could disseminate that, and that is for individuals to save their PPE so that it can be reprocessed and reused, because there are safe methods to do that. But once one discards it, there's not that local supply chain to do the reprocessing. So it's very important that individuals, rather than discarding their PPE, save their PPE. And it just so happens that the state of New Mexico was able to get a mobile unit from Battelle Memorial Institute. Okay, they actually designed these mobile units. And New Mexico is very fortunate to have one of those. There were 60 units that were disseminated across the country. We have one of those units that will be located in Rio Rancho. We as a state have one of those. And that system has the ability to use that hydrogen peroxide vapor and decontaminate up to 83 N95 respirators within an 8-hour period. And that is literally just getting underway. So different health facilities and institutes throughout the state of New Mexico should go to the website set up by the New Mexico Department of Health and look for that information, because that is a really robust source of maintaining the PPE supply in the state of New Mexico. So the hydrogen peroxide vapor is something that's standardly used, for example, to decontaminate laboratories and operating rooms, hospital rooms, etc., when there are dangerous pathogens in there. And so that hydrogen peroxide vapor is commonly used in research and hospital settings. And so that's the methodology that maintains the integrity of the masks, kills the pathogen very efficiently, and allows one to reuse that PPE. And that's hydrogen peroxide vapor. So we set up a system in the operating rooms, two operating rooms at UNMH. But this is actually the one from Battelle. It's under a DoD contract. That's a large mobile unit. In this case, it will be fixed in Rio Rancho. I'm told at the Santa Ana Star Casino. And then one would send their PPE from their institute. It gets packaged and shipped, and then you actually get your PPE back. And so that's just getting underway, and that is a really great resource for the state. And Trudy Cordova is actually leading that up.
Thank you so much for your time. I know you're very busy, and thank you so much for your COVID-19 research efforts.
Anytime. There's lots of interesting stories and lots of people working very hard.